Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore the treatment options for leukemia and how they work, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Leukemia treatment can vary greatly depending on the type of leukemia, its progression, and the overall health of the patient. But the main goal is always to destroy the leukemia cells and allow normal cells to form in the bone marrow. Chemotherapy is one of the most commonly used treatments for leukemia. This involves the use of one or more drugs to kill cancer cells. The specific drugs used and their combination can vary depending on the type of leukemia. Radiation therapy uses high-energy radiation to damage leukemia cells and inhibit their growth. It can be localized to a specific area or it can be applied to the entire body. Targeted therapy is a newer treatment strategy that uses drugs to specifically target certain vulnerabilities in cancer cells. For example, tyrosine kinase inhibitors are used to treat chronic myeloid leukemia by blocking a specific protein that leukemia cells need to grow. Immunotherapy is a treatment that uses the body's own immune system to fight the cancer. One type of immunotherapy, called checkpoint inhibitors, helps the immune system recognize and attack cancer cells. Chimeric antigen receptor (CAR) T-cell therapy is a type of immunotherapy where some of a patient's T-cells are modified in a lab to attack their leukemia cells. This is currently used in certain types of lymphoblastic leukemia. Stem cell transplant, also known as a bone marrow transplant, is a procedure to replace the diseased bone marrow with healthy stem cells that can grow into new bone marrow. This is often used for patients whose leukemia has not responded to other treatments. Biological therapy or targeted therapy uses substances that bolster the body's natural ability to fight cancer. For example, interferon is a type of biological therapy used in treating certain types of leukemia. Clinical trials provide access to new and experimental treatments. Participating in a clinical trial might give you the chance to try new treatments and contribute to improving leukemia treatment for future patients. Supportive care is also an essential part of leukemia treatment. This includes treatments like blood transfusions, antibiotics, and other medications to manage symptoms and side effects of leukemia and its treatment. Lastly, watchful waiting may be a viable option for certain types of leukemia that progress slowly, like some cases of CLL. Patients are closely monitored and treatment is initiated when symptoms begin to appear or change. In summary, leukemia treatment is multifaceted and could include chemotherapy, radiation therapy, targeted therapy, immunotherapy, CAR T-cell therapy, stem cell transplant, biological therapy, clinical trials, supportive care, and watchful waiting. The goal is to eliminate leukemia cells, allow normal cell formation, and manage symptoms to improve the patient's quality of life. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.